This is an applied social research study what aimed to tackle why young people disengage from diabetes services living in the East End of London. We recruited and worked with a group of young people living with diabetes. They helped to co-design the methods and the approach we use to talk with other young people living with diabetes, their families, as well as the teams what surrounds them.
It was a really positive and rewarding role. It's in a field that, something that I was living with diabetes. It gave me the chance to improve the services for other people, for my younger sister who's now 2. So for me, I see it a good thing because I was helping something that, I had and other people could now use.
Together, we co-designed the investigation process, analysed the data, and as a result, we were then able to influence and shape the future commissioning specification and guidance for Newham, as well as national transition plans from paediatrics to young adult services. We were also able to influence NICE guidelines, as well as in real time change practice on the ground. Result of this project, we developed the Young Commissioners model, which is a paid or voluntary role which meaningfully involves young people in the commissioning process. We were able to ensure that young people add a voice in the services they need in a way they want it and across a care pathway what was relevant and applicable to their daily lives.
Being a young commissioner allows for sort of younger people to be able to make a proper change within their community, as in they're able to make sure that various types of people and various groups are able to sort of receive help and to receive the sort of care they need in a way that is able to be accessed by the young people. So we are able to make change because we are able to experience these things and we can understand a lot better and empathise with people in difficult situations, especially when they're young.
It's not a tokenistic approach, which is with all the best intentions, it's very easy to do this in a very superficial way. I think what the Young Commissioners model does, it gives us a framework for recruiting, training the young commissioners, so upskilling the young people so that they can work with health professionals and commissioners. But also it's about training the organisations themselves, so training the health professionals in how to work with services and give up a bit of their power and authority in terms of the design of services. So I think what our model does, it's a tried and tested way of supporting organisations, very busy organisations, to actually do meaningful co-production.
For anyone wanting to adopt a youth commissioner model, I do strongly advise it because if you're commissioning children and young people services, it only makes sense to understand their need from their perspective. Otherwise, you're commissioning services that aren't being used.
Don't look at it from a linear perspective in that it's only about ticking a box, getting children and young people involved because it looks good on paper. I think we have to realise that there are significant benefits to children and young people being involved throughout the commissioning cycle, right through to quality assurance and evaluation.